into session. And can I have a report of the action taken in closed session? So David,
Yes,
could you do that for us?
Certainly. There were 4 items considered by the board in closed session. The first 2 were hearings under Health and Safety Code 32155. There was no reportable action on those items. The third item was approval of the December 17th, 2020 closed session minutes. Those were approved on a 5-0 vote. And then lastly, there was medical staff credentialing that was considered by the board, and those credentialing recommendations were approved on a 5-0 vote. That's all.
Okay. I'm sorry, David, did you say that 5.1 and 5.2 had no approval, or did?
No reportable action.
Okay. Thank you. Are there any deletions or corrections to the posted agenda? Okay. Hearing none, is there any input from our audience? And I did review the guidelines for giving input earlier in the meeting. And for the open session, if you want to give input on an agenda item, then you can just wait until we get to that agenda item. But if you want to speak on something else, you have your 3 minutes to speak. And if you're wanting to send the comment in, you can do that by email to our clerk, and the email address is on our agenda on the website. We did receive one audience comment, and we did forward that to our medical staff for review and consideration. So currently, is there anybody that wants to give any audience input on something not agendized? Okay. Seeing and hearing none, we'll move on to input from our Employees Association. It'd be nice to see somebody, but I don't. So then we'll move on to Safety First, and that's Alex McLennan, our Chief HR Officer. Alex, are you there?
I'm sorry, I was double muted. Can you hear me now?
Yes.
Yep. Okay. I have the honor this month to do Safety First, and I went through, and I have to give credit to Denise Strakner, a patient advocate who put this together. And I'm going to talk tonight about walking in the ice and snow. And I thought it was a good topic for tonight, so you can all, go out and shovel your driveways carefully. So believe it or not, there's actually an association of snow and ice management. It's called the Snow and Ice Management Association, and they come up with these tips for walking in the ice and snow. First is wear proper footwear. Wear shoes with heavy treading and flat bottom that place the entire foot on the surface of the ground. Wear things that help you see and be seen. Wear sunglasses so that you can see, also bright and reflective clothing to help you be seen by drivers. Plan ahead. Walk consciously on icy walkways and parking lots. Look up to see where your next icy spots are and be aware of any vehicles close to you. Listen. Avoid listening to music or talking on the phone while walking on icy or snow conditions. Pedestrians need to be able to hear approaching traffic or other noises. Anticipate the ice. What appears to be wet pavement may be black ice, so approach it with caution. Take your steps slowly. When walking down steps, take them slowly and deliberately. Plant your feet securely on each step and be sure to have a firm grip on the handrail. Enter buildings slowly. The floors in buildings may be covered in melted snow and ice, so check the entrance and try to step on any rugs in the doorways. Avoid shortcuts. A shortcut path may be dangerous because it's less likely that the snow and ice removal has occurred. And lastly, look up. Be aware of what you're walking under. Falling snow and ice can cause injuries. And we always like to say, walk like a penguin. Concentrate on maintaining your balance. Take short steps. Walk flat-footed. And walk with your arms at your sides, not in your pockets. And those were all safety tips from the Snow and Ice Management Association. And I'm giving credit to Denise Strakner who's our patient advocate. And that is our safety first tonight. I hope you are all walking very safely. I will say it's actually a really serious topic. We do have employees that fall we had 2 today that fell. And so really important to make sure that we all stay safe, because we don't want any injuries from any of our people, including our board members. Stay safe out there.
Thanks, Allison, and very timely. And we hope that our CEO has heard the words of being careful.
Walk like a penguin.
Yeah. Well, yeah, exactly.
I saw him laughing the whole time. I'm not sure what was going on.
Oh.
Okay, but definitely words to really pay attention to during this, especially during this week. And then Alex, you're also going to do the acknowledgements for this month.
Yes, and I'm super excited to announce our 340B analyst and pharmacy procurement technician, Lisa Sordelli, as our employee of the month for January. Give it up for Lisa.
Yay.
All right. So here's what her colleagues have to say about her. Lisa goes above and beyond to support her coworkers in the pharmacy and in other departments. She's always saying, no problem, let me take care of that. Or, is there anything you need me to do? Her job keeps her very busy, but she still makes sure that her coworkers are doing okay and offers help when needed. Lisa cares about her community and always is concerned for the patients. Recently, she went above and beyond her duties for a COVID positive patient by driving to Grass Valley and back after her regular schedule to get a specific drug for the patient. Lisa comes to work with a positive attitude and is such a valuable member of the pharmacy and the health system. She truly is an example to follow as an employee at Tahoe Forest Health System. Congratulations, Lisa.
Yeah. So could you tell us what a 340B analyst is?
I cannot.
Okay, but obviously,
well,
obviously
so what I can tell you, so there's a regulation out there on 340B, and I don't have all the intricate details. Judy probably could talk to you about it more, but she's the one helping us out with that. Oh, that's why. Okay. So
she's conveniently turned her camera off.
It's a pharmacy drug program for us to get better pricing on certain drugs and medications through this program because of us being, a critical access hospital in a rural area. And Crystal can probably speak a little bit more to the financial aspect of it. But it's a great program and it's very specific, and you have to be very diligent and exact with what we're doing with the program.
Obviously, she does the procurement. She'll drive all the way to Grass Valley to get the drug so that we can have it. And we really appreciate the work that she does in our house, as well as when she has to go out to get what we need. So thank you so much, Lisa. Okay, item 14, the consent calendar, and these are usually just reports or non-controversial reports. But is there anyone that would like to pull anything for further discussion on our board? Does anybody on the board have?
Yeah, Alice?
Yes.
Mary, I wanted to pull the financial statements.
Okay.
I thought it would be beneficial. I'll tell you later why I pulled it. I'd like to pull it.
Okay, so we've pulled that one. Are there any other reports that anybody wants to pull from the board? Are there anybody in the audience that likes to have a report pulled for further discussion? Okay, if not, can I have a motion to approve the consent calendar minus the financial reports? And then we'll do the financial reports under item 17.
So moved by Dale.
Okay. Could I have a second, please?
I'll second, Michael.
Okay, so it's been moved by Director Shamlin, second by Michael McGarry, that we approve the consent calendar minus the financial report. Martina, will you do the roll call?
Director McGarry.
Aye.
Director Shamblin.
Aye.
Director King.
Aye.
Director Brown.
Aye.
Director Wong.
Aye. Okay, and Mary, if you'll just remind me, at item 17 that you wanna talk.
I will, thank you.
Items for board discussion. Our first one is Dr. Cole, and she's going to talk to us about the COVID vaccine. She's going to do a presentation.
Yes. Hello, everyone. So this evening I was asked to kind of go over the COVID vaccine information. This is information that was presented to the staff in a lunch and learn type presentation. I then also gave this a shorter version of this presentation to the Rotary Club. I do want to let you know we're in the middle of a storm. I'm trying to do my Zoom on my hotspot on my cell phone because I have no internet service right now. So I just want to apologize if I do cut out. I was going to head into the hospital and my berm was 5 feet tall, so I decided to stay home. So I'm hoping that this will last. And what I'm going to do is kind of go over the top questions that people have so that you could potentially inform your family members, our community, or people can watch this on our website if they have additional questions. We will be doing the similar type format for the community. We're going to be doing it in Spanish. I'm going to be doing that with Dr. Scott Samuelson and Sam Smith, who's one of our physician assistants. And we'll be doing that completely in Spanish, along with the following, either the day before or the day after, we'll be doing one in English in hopes to kind of catch the community members and really educate them on why this vaccine is safe and effective. So with that being said, if you have questions after I'm through, I'm happy to entertain any questions. I can't guarantee that I'll have the answer, but I'm happy to answer any that I can. So I think one of the biggest questions that come up is that this vaccine was developed very quickly. And so how do we know that it's actually safe? And what I want to explain is that the technology for this vaccine has actually been around since 2005. So 15, 16 years, this type of mRNA vaccine technology has been around. It's been studied with other viruses, obviously not this specific virus. And amazingly, the US government and the National Institute for Health were able to quickly enroll 60,000 people to study this vaccine. Why were we able to get it done so quickly? Well, it was multifactorial. Partly it was because the government wanted to push through this research project very quickly. Part of it was because not only were they enrolling people and giving the vaccine, they were doing it while they were still manufacturing the vaccine. So it was done not in successive steps, but actually concurrently together. Because the trials were so amazing and the vaccine was so effective, greater than 95% effective rate is extremely high for a vaccine. They were able to push this through even faster. The other thing about the vaccine that's important to know is that it's only made up of a very, very few ingredients. It is made up of a small mRNA particle basically surrounded by fats. There's no preservatives, there's no aluminum in it. It's remarkably simple, which also makes it very easy from a safety aspect to push it through. Another big question is, if this vaccine is so safe and so amazing and so effective, why didn't we just get a full FDA approval? Why is it only emergency use authorization at this point? And the reason is really just red tape. So the emergency use authorization kind of cuts through the red tape. The FDA still looks at all the safety data. They're looking at all the research. None of that is forgone with this emergency use authorization. It's really just the process, paperwork, red tape that they're able to actually push through when you do the emergency use authorization. What we do know is that the 60,000 people that were in the clinical trials, that they have been studied now for about 4 months, and there haven't been any safety concerns in that 4 months, which is super amazing. A lot of people then ask, well, what do we know about long-term side effects of this? And honestly, we don't know about long-term side effects. However, what we do know is that all the other vaccines that have been approved through the FDA process, any long-term side effects actually pops up within the first 6 weeks of giving the vaccine. So since we have 3 to 4 months of data, in this, we feel very comfortable that if there were side effects to occur, that it would have happened already, just based on prior data. The other thing that's interesting is that the actual vaccine ingredients are actually gone from your body in 2 days after the vaccine is given. So you get the vaccine, it's in your system for 2 days, and then it's not detectable after that, the actual ingredients of the vaccine. So another question is like, is there anyone that shouldn't get the vaccine? Like, who are those people? And there are a few people that shouldn't get the vaccine. And the first and foremost is somebody who's had a severe anaphylactic reaction to injectable medications, and specifically ones that contain polyethylene glycol, which is the substance in this vaccine, the inert ingredients in it. And the reason is because we obviously don't want to put anybody into anaphylaxis. There are questions about autoimmune disease or recent history of cancer or HIV, and I want to let you know all of those people were actually included in the studies. However, they were included in the studies, but we didn't have enough of them in that study to really make a good assessment on it. What we do know is that we saw no side effects in those people. What we don't know is, are they as efficacious? Is this vaccine still that 95%? If you have an autoimmune disorder, would your body mount the same response as somebody without the autoimmune disorder, or without the cancer, or without HIV, etc.? What we do know is it's not a live virus, so you're not going to get COVID from this vaccine. Unlike other attenuated live virus vaccines where that can happen. So this makes it safe to give people who are immunocompromised. Another big question is, if I've already had COVID, should I be getting the vaccine? And the answer is yes. At this time, what we think is that the natural immunity from COVID probably falls off quicker than the immunity from the vaccine. The other question a lot of people ask is, are we going to need to get booster shot like the flu shot every year? Or is this going to be more like the Tdap vaccine where you can get every 5 to 10 years? Like, what is the schedule? And at this time, we really don't know. And we'll be watching those 60,000 people that were in the trials to really know and understand when those antibodies start to fall off, when their infectious rate starts to increase, and how quickly will we need to give another vaccine. Couple more questions. One is the new strain that's coming out. My understanding is the new strains that I have been able to research, the mRNA particle is on the spike protein, which is what gives it this the picture that most people see with the spikes outside the circle. It's on that protein, and that protein had not mutated yet. So the thought is that this vaccine will protect us against all of those new strains that are coming up. Now, that doesn't mean that there might not be new strains in the future that will mutate on that protein, but at this time, we haven't found one that has. Another good question is, should I just wait and watch and see whether or not there are long-term side effects? And the reality is that the risk of COVID and the risk of hospitalization and major illness is likely much higher than the risk of this vaccine. And so the recommendation is to really go ahead and get this vaccine before you get exposed to COVID. So I'd like to open it up to any questions if you guys have anything.
This is Art. I've got a question. So how many have we vaccinated locally, and what is our target? I mean, how many do we want to vaccinate?
I'm going to hand that one off to Judy Newland as our Chief Operating Officer. I do know that we have done an amazing job within our health system and through phase 1A and have started into our community, but I'm hoping she has more updated numbers than I have in my head.
Yeah, so we have vaccinated 813 employees to date. And in our Eskridge conference room, where not only we did employees, we also expanded our phase 1A immunizations to community members. We've actually first and second doses have given over 2,000 doses in that location. For Sierra College, we've given 630 doses as of today.
Okay, thank you.
What is our vision and how many? Our vision is to give as many shots and arms as fast as we can to meet the needs of the community. And that's really based on allocation of vaccines availability.
Okay, thanks.
So Dr. Cole, I know that they have not tested or have not done trials with pregnant women with the vaccine, but you had mentioned that this type of vaccine has been around since 2005. So do you know if it crosses the placenta or not? There are some women in our community that are asking the question and they have a little bit of knowledge, but it might be lethal.
So currently the recommendation by the American College of OBGYNs and the Society for Maternal Fetal Medicine, which is the high-risk OB specialists, their recommendations are that if you are up for vaccination, meaning that you are, in that tier where you should be offered the vaccine, that vaccine should be offered whether or not you're pregnant or not, and that a pregnancy test is not required prior to vaccination. At this time, we do not have enough studies in pregnant women, but there is no plausible scientific thought of why this would be harmful to the infant or to the pregnant mom. And what we do know about pregnancy and COVID is that you have a 5 times higher rate of intensive care needs if you get COVID in pregnancy. So because of the morbidity and mortality of COVID during pregnancy, that is why there is a big push to get our pregnant women vaccinated, even without the current studies. ACOG is also urging that studies are done on this. And I do know that if you are pregnant or breastfeeding, they are watching very closely and typically are enrolling people for observation that way.
Thank you.
Also, there is no plausible reason why COVID itself or why the vaccine would cause any infertility. And somehow that got out in the media and it's not correct information.
So Judy, also you had said that we want to get as many vaccines and into many arms as we can. And so I know we don't have the vaccines, but if indeed we get an allocation where we can do mass vaccinations, do we have the staff and personnel to do it? I know that it has run so well. I had mine at Eskridge, and I've had friends who had it done at Sierra College, and they couldn't say enough about how well run it was and how welcoming they felt and moving through the process. But I wonder if we have the manpower now, if we got the vaccine, to do as many as we could.
So currently the location we are in, which is Sierra College, and very appreciative of Sierra College to allow us to do those vaccinations. We're able to do 160 vaccinations a day. We chose that location initially so that recognizing that we believed our initial audience for vaccinations would be over 75 or over 65 in the middle of winter. So we did find a location where we could accommodate as many as we could as possible so that we could vaccinate in a closed environment. We do anticipate being able to, as the weather improves, being able to move out to the airport where we are estimating 500 or 600 per day. We are currently have 2 RNs that vaccinate plus a third that prepares the medication. The state of California actually will be providing us additional 2 LVNs and 2 staff to help support support that clinic. The real intent of that is you have your first dose, but then you still have to do your second dose. So our goal is, if we have the allocation, we would continue with first dose 160 a day at that location, plus then continue with the second dose without stopping the first dose. But it's really all dependent on the allocation.
Because on the media, you know, they're saying that they're calling the National Guard in and some of the military troops to administer as well as distribute the vaccines. And I'm thinking, do we really need that when there are other things that they should be doing and could be doing? And that they were also saying they're asking retired nurses and physicians to volunteer to do vaccinations. And that opened a whole nother quagmire for me in terms of, you know, there may be people with licensing, but, you know, not liability. And are you covered by the Good Samaritan Act and yada, 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 yada. So I just want to make sure that we have enough people giving them. Yeah. Thank you.
Judy, Dale here. How long before you receive a shipment of vaccine, you get notification that it's coming so you can plan the appointments and plan the providers?
Well, that is not a black and white. There's not a black and white answer to that. So we usually, the few allocations we've received, it's not that, you know, we've received 1, 2, 3, 4 allocations and one we had to return. You get notification, usually someone will come and tell you, hey, we're going to give you some vaccine, and it'll arrive within 3 days possibly, and you need to begin using that. So it depends on the delivery time. I think it's really, once we know, it takes 3 or 4 days to come.
Okay.
Yeah.
Yeah, and just recently, I think it was on television today that they've talked about Blue Shield is taking over as the third party administrator of the vaccines in California. And it's not going to happen right now, but the rollout will be in a couple of weeks of knowing ahead of time how many doses you're going to get and when you're going to get them. So hopefully that all works out so that you have, I mean, right now it's a crystal ball of how you're going to try to cover everybody because you don't know what's coming.
You know, Director Wrong, if you'd like me to, once the questions are done with Dr. Cole, I'm happy to give an update, maybe a little bit more information. I know there are a lot of questions, and this is a great audience to give it to, plus those that are listening. So
I'd appreciate that, Judy. Thank you for offering. Thank you, Dr. Cole, for the information about the vaccine as well.
Yeah.
I found that fascinating. Thank you. You know, I think we've all read a lot about the vaccine, but there were a couple of interesting points in there that I've never heard before, like that the vaccine components only stay in your body for 2 days. I didn't know that.
Yeah, it's interesting.
Yeah.
Any other clinical questions for me? Anything else that I can answer? Yes, Art?
I've heard that there's a bigger chance for a reaction with your second vaccine than the first. Have we seen that at all?
Yeah, that is true. The immune response tends to kick up after the booster shot because you've had the substance in your body previously. People tend to be fatigued, sore arm. Some people get chills, body aches, even low-grade fever. Those are all normal, typical responses. I actually, when I gave my Lunch and Learn, was telling people I hoped to get those symptoms because then I knew my body was doing something. I was one of the few that had no reaction. I had a little bit of a sore arm, but I was kind of bummed because I wanted to know that my body was making those good antibodies against it. Now, with that being said, side effects do not ensure efficacy. So that's just was my concern, but it is not a logical concern.
Okay.
And I do want to say that Judy's team has amazing, well thought out intra-agency plans for vaccinations that are just I'm just so proud to be part of this team. We just need the vaccines to be able to implement it. So if anybody has any, pull at Pfizer or Moderna, you just go ahead and do that and get us some vaccine.
All right, any other comments or questions for Dr. Cole? Thank you so much for that informative presentation. And I'm looking forward to having you going out into the community and giving it. And you said that you would have it in English and Spanish. And so I wondered, where are you going to be doing some of these presentations that you're going to get to some of those Spanish speaking individuals and convince them? Because I understand that there are like 26% of the Hispanic population that are considering taking the vaccine.
Yeah, so we will be doing a Zoom type presentation on February 8th at 6 p.m. And we are getting out into the community to let them know about this presentation by utilizing our wellness neighborhood and the amazing advocates there, along with our community partners to get the word out. And then I believe the plan is, if technology permits, is that we will go ahead and break those questions up and put those questions hopefully on our website so that people can just click on it if they have a specific question, and they will get the question and answer right there.
Okay, well, thank you again, Dr. Cole. And then Judy and Harry, we'll move on to your presentation on COVID-19. And I don't know who wants to start.
I'll let Harry start.
I'll just have a brief, about 60 seconds, and then let Judy share a lot of great info. I think for our board and our community, what we're really pleased to see at a high level is no persuasive mathematical evidence of a fourth surge. So our last surge started roughly 2 weeks after Veterans Day and extended into mid-December. And we're just really pleased with how our communities, plural, have handled the Christmas and New Year's period. We track it graphically, and we hope there are no more big surges. The third surge was the biggest one so far. And so I think that's the big global news. I think the key thing that would be valuable for you is to hear kind of just a logistics report from Judy, and she's been on the phone daily with multiple counties and other community folks. And we just really appreciate our partnership with Sierra College, with the town, with the fire department, with police, a lot of great partners here. So Judy, I'll turn it over to you.
Thank you. And thank you, Dr. Cole, for mentioning the response. I have to tell you, it reminds me of how proud it is to be part of this health system, because both at Incline and Tahoe Forest, the rapid response to support our communities through a vaccination process has been tremendous. And what gets communicated and what we think will happen one day changes the next day, but everybody just keeps moving forward. So I'm delighted to be able to just kind of give you some background and where we are today. So one of the places I really want to start with is reminding everybody that it starts at the federal level. The federal level has the vaccinations. They look at each state and they depend on the population. They allocate so many doses per state. Then what the states do is they look at the counties, and then based on county population, they allocate so many doses per county. So Tahoe Forest Health System works with 2 states, state of Nevada, state of California, and we are working with 3 different counties, Washoe County, Nevada County, and Placer County. And I will tell you, each county has a different process, and each county has a different allocation, and each county has different resources. So it creates, again, just making sure that we continue to move forward and we respect each of the counties. So if I can start with Washoe County and Incline Village Community Hospital and what's happening there, that would be the easiest. We'll start there. So just so you know, Incline Village actually has what we call 3 providers that provide vaccines to that community. The Rayleighs, the fire department, and Incline Village Community Hospital. And what happens in the process is the counties determine who you vaccinate. The provider does not have a choice. So in Incline Village Community Hospital was informed that we would be vaccinating over 70. And so that is all we have vaccinated. We haven't vaccinated our own employees, and then we vaccinate over 70. The fire department is vaccinating other people, and Rayleigh's is vaccinating other people. So that is our responsibility. So it just so happened one day we got a call on a Friday, and we were informed that we can give you 100 doses if you can begin vaccinating next week. That's how fast that happened. And so the team there said, yep, let's do that. That's our responsibility. We want to support our community. So we said, yes, please send us 100. We received 100. And in the meantime, on Friday, we determined the process on how we'll vaccinate. We'll have people call in, we'll schedule them, and then we'll vaccinate. We created a phone number that day in preparation to release it on Monday. Well, it ended up getting released somehow through the community. And by Monday morning, when we arrived to work, we already had 80 calls, another 60 that day. And within 4 days, we had 1,000 calls on that phone line requesting to have vaccination. Besides that significantly overwhelming 1,000 calls, that hospital and that team has totally responded to that. We have physician returning calls to patients. We have all kinds of staff returning calls, with them recognizing that we want you to know you received the call. We received your call, and we will call you when it is time to vaccinate you. And that has been the process. So as of today, they have vaccinated 360 residents. They do approximately 50 a day. We are about getting 200 a week. Now that's our goal, is to receive 200 a week. Eventually, we're looking to go to a self-schedule program where the community can self-schedule. So not only do we have the calls that are coming, actually Washoe County is actually giving us individuals over 70 that they've requested that we contact. So we're moving forward. We'll be looking to reopen that up to the community. The advantage of Washoe County is they have a lot of locations for vaccination. So you can go onto their website, and there's locations in Reno, Renown, I believe St. Mary's, Walgreens, Smith's. So a lot of communities have the opportunity to go down there, get vaccinated. They have been a great partner for us, and we really appreciate the opportunity to be allocated about 200 a week. So that's been going very successful. And really,
Judy, who vaccinated our employees then? If
we vaccinated our own employees.
Okay, because you said that they were to vaccinate over 70. So I got the
I
impression.
apologize. So we've started by being told that we would vaccinate our own employees. So we received, I think, 80 doses or 90 doses to vaccinate our own employees over a time. Once that was completed, and again, once the county opened up to the next tier, then we did over 70. Washoe County has, I think you'll find that all counties have been very careful in going through their system. And so the state of Nevada is a little different than California, but in general, they start with healthcare workers, and then you have to finish healthcare workers in hospitals, and then you go to EMS, and they go down the line. And once they did all of those, dentists, et cetera, in their Washoe County, dentists, chiropractors, then they opened up to the next tier, which they call tier 2, which is over 70, and then the educators and et cetera. So that's their process. And I will say they have, in Washoe County, they do have quite a few resources. So they've been able to open up at the rodeo grounds, and they have they call them lanes. So every nurse is a lane. I love it. So they have like 10 lanes, and they can put quite a few people through in one day. So they've been able to vaccinate, I think they're almost up to, in Washoe County, almost up to 50% over 70 in a week or so. So they are moving very fast. But again, you have to understand that counties have different resources and different capacity and different budgets in order to support the vaccination process. So,
Judy,
yes.
Quick question. Do you have to be a resident of a county to get a vaccine in that county?
Yes, that's the request. That you remember that vaccines are allocated based on resident volume.
Yeah.
So the request is that in most counties, you have to be a resident. Now,
Okay.
we noticed in Florida that worked a little bit different. So states can be different, but that is the request that you schedule. And
Say resident, you know, I have a number of friends who have second homes here, and they spend almost 50% of their time here, but their driver's license shows their primary residence elsewhere.
yeah, so we consider second homeowners part of our community. So it doesn't, if you're a second homeowner, we just ask that you show some type of, you know, piece of paper that maybe your electric bill or something. But if you're a second homeowner, we will vaccinate you both in Incline and in California.
So you will, okay,
Yes, absolutely, absolutely.
okay.
I mean, you know, we need to vaccinate people, and we don't want to slow that process down. So,
Well, but when I got mine vaccination, I had to present my driver's license, and, as I recall, and some people do, and my driver's license obviously
Right.
establishes. If you're a second homeowner here, your driver's license would not establish resident.
that's true. We do ask if you could bring an electric bill or something like that.
Gotcha.
I mean, that's what we ask.
Okay.
We haven't turned anybody away. So,
Okay.
and we do understand, please understand that you could, so you could, if you're a healthcare worker and you work at up here in physical therapy, but you live in Reno, you can be vaccinated here because this is where you work.
Okay.
So, but over, you know, when you get into age, we do request that you are in that county. Have we turned anybody away because they aren't? We have not, but we do really request that people are in their county because that's how we're allocated. So, and we don't get a lot of allocation. So we have to be very, you know, we want to make sure we get even our primary and secondary residents here. So moving to Tahoe Forest Hospital, I just want to just quickly again go through the employee. So we've vaccinated 815 employees. That's about 70% of our employees. So actually, we think that that's really a good percent of those who want to be vaccinated. There are some that, you know, may not have been able to because of leaves or et cetera. So we assume that number will increase, but that's what we have done. Once we completed vaccinating our employees, we had more vaccines. So we did reach out to the county, and the county asked us to continue vaccinating those who are in phase 1A. So if you go into that, there is a tier system, tier 1, tier 2, tier 3. And so what happened with that is the county actually gives us the people to vaccinate. We don't just vaccinate, assume people are tier 1A. The county gives us the names, and they actually have on their website, if you think you're tier 1A, you can go in and you can sign up, and they vet that, and then they send us information if for us to vaccinate. And so it's really a collaboration between the two counties at the hospital. So I do want to mention again that in Placer County, the east side, there are two providers that provide vaccinations. That is the Kings Beach Safeway, and that is the clinic that we have at Sierra College. In Nevada County, there's actually three providers. There is the Truckee Safeway, there is the clinic at the Sierra College, and then the local county health clinic also can provide vaccines. And again, we are instructed who to vaccinate. So I currently can't tell you who Safeway is vaccinating. But we are provided that information on who to vaccinate. So the big challenge we have in our process is we have two counties that we are working with. We have Placer County and we have Nevada County. And I will say they have been great to work with. They're very supportive, but again, you know, each county moves at its own speed. And so, you know, sometimes there are communications that people don't understand. And it's really because the counties are still, they're learning, they're working at their speed, and yet we have to work with them and make and really get clear direction. So about a week and a half ago, we finally were able to get authorization that we can open a clinic under the guidance and under the direction of Placer and Nevada County. We use Tahoe Forest Hospital staff, but it really is a sort of a county program. We did get authorization to open a clinic at Sierra College. We had, I think, about 3 or 4 days notice to do that. And we were instructed at that time, Placer County was opening to over 65, and Nevada County agreed, go ahead. Their whole county had not opened to over 65, but we really appreciate that they were thinking about how important it is just to vaccinate. So we did open to over 65, and I will tell you, I think we had a very successful opening. Thank you to the team. If you haven't been up there, it's an amazing design. And we were able to vaccinate that week, I think 570 individuals. When we finished that week, we used most of our vaccine and we're only left with a few doses. We reached out to the counties and said, what would you like us to do this week? Knowing that there were storms, but also we just want to make sure we use our vaccines. We were asked to complete what we call phase 1A again. So they had more people that had gone onto the websites and said, hey, I'm phase 1A. And so this week we've actually been completing phase 1A, which is it's been about 150, maybe almost 200 more. And that will occur tomorrow. That will be one more day. We didn't have because of the weather, and we didn't have the allotment. We didn't open all 5 days. So what happens next week? So we have a meeting tomorrow next week with both counties. One of the things they've been really working on is really that moving down the same lane. You know, because Placer County opened at over 65, but you all may have seen that now Nevada County has opened over at 75. So what do we do at our clinic? So we've asked them and they have agreed, you know, and they most certainly want to collaborate. So they will let us know what we will vaccinate next week, and we will learn tomorrow what our allotment is. So I know that's not easy for the community. Sometimes the communication that comes from the counties are confusing. So we understand that, and our hospital gets a lot of calls. But again, I just want everybody to understand we're here to help the counties. That's our job. And they actually give us the direction. One of the things that the counties we are working with on the county is all future appointments will be notification will occur through their text alert programs. And that actually was posted on our website today. So, and we're doing that because that's how the counties are doing it. So what will happen is we are asking all of our community members to join either Placer County, their text alert, or Nevada County, their text alert. And what happens is any new information or that type of information, our phasing changes gets notified, and it also notifies individuals appointment availability. So I believe this morning or yesterday, Placer County sent in a text that said that there are more appointments available on Friday at a clinic in somewhere in Roseville. So that's how our community will know when there are appointments available at the Placer, Nevada County, Tahoe Forest vaccine clinic. I know it's confusing for the community. I think nationally it's always a challenge to understand the process, but we really want to make sure that our counties, you know, want to oversee the program, and it allows then the notification to come through all at the same time. Because I know people, you know, it's hard when you want to get a vaccination and you want to make sure you're notified. The other thing we're working, just so you know, we are working with the counties on how that gets communicated. There's been some confusion, and I think even though we have the two Placer, Nevada County in itself is confusing. How the west side of the county administered the doses is different than how the east side doses are done. So we do our administration through a clinic. On the west side, the physicians are independent practitioners, and they do it through their physician offices. So when the county says, call your physician to make a vaccine on the west side, people don't see that word and they're calling on the east side. And so they're very frustrated that the physicians on the east side can't schedule them a vaccine. So I just wanted you all to be aware of some of the occurrences so you can talk to people why the confusion. An example was today, meaningly well, the Nevada County sent a text out regarding how to get an appointment. And it just happened to mention in one of the texts that Tahoe Forest Hospital will be doing over 75. It never said there were appointments, but people read that as their appointments. And so they, of course, they walked into the hospital looking for appointments. So I really appreciate Nevada County and both Placer County looking at how they communicate. They were very responsive to our requests. They really understand the importance of communication, and we are working together as a team really to try to have one voice. And I appreciate the counties working together also to have one voice on how we move forward on the east side of both Placer and Nevada County. So I hope that was helpful.
Yes.
I found it very helpful, Judy. Thank you. And the one thing that I want to ask is, where will it be on our website as far as getting onto the text alerts? I think that is going to be so helpful. I know that Harry might have gotten the email, but from from one of our residents who was really frustrated. He felt that if you had an inside connection, you got an appointment. But we lowly residents who don't know anything, we were left out of the appointments. And I know that you got lots of calls for the appointments, because as soon as it got out on the website, as soon as by word of mouth people heard about it, they were all calling, which is exciting to me to know that there are that many people in our community that want that extra layer of protection for themselves and for the others.
In fact, it's funny, I've heard that, I wish people could have been in the room when we said, okay, we're going to get it on the website now. All of this communication has to go out at the same time. And we sat there and made sure it all went out at the same time. I mean, it was very stressful. So I appreciate people have a perception, but that is actually not what happened. And I'm so sorry. Our initial goal was to have 8 vaccination days. Unfortunately, we only had 3.5. The 8 would have made a difference, but we are where we are today.
So we're on our website. It'll be on the Tahoe Forest website.
It is there now.
Okay. And is it on the COVID-19 link?
It's on I think it's, sorry. I know it's on the vaccine, and I believe it's also on the COVID-19, but it's very clear. And we also will be sending that out hopefully tomorrow or soon on my chart. So those people initially 65 and older on my chart understand to sign up on the text alerts. We want to make sure before we have any appointments that people have some time to see that information, and they can get a text alert, sign up for that.
Because there is another one that's put out by the county. It's called My Turn, but I think it's it's web-based. You have to have a computer in order to do that.
So My Turn, just so
Judy?
you all understand, My Turn, Ted, did you want to say something and then I can explain My Turn?
I was just going to tell Alice where the text alert is located on the web page.
Go ahead.
It's COVID. You click COVID, click vaccine, and then you go down to vaccine information, and it's right there.
Okay, thanks so much.
Both counties.
The My Turn is a new program from the state of California. The goal is it's a statewide program for self-scheduling. So currently any county can use what they want. We use PrepMod. Thank you to Placer County for letting us tie into theirs. It allows for self-scheduling. The My Turn is a little more sophisticated program in which then it'll be managed by the state. And, they'll actually have a group of people that will answer the questions, and Spanish speaking you can go to. And when the appointments come up, again, you would be notified by a text, and you can go in and actually you'll make your first appointment and your second appointment at that time. So it's done at the same time. And so it's a statewide initiative for everybody to try to use My Turn. Any other questions?
Yeah, Judy, if you sign up for the text alert, so and you get a text, So then what happens? Do you have to call in? Do you have to go online? I mean, can you actually get through to somebody to make an appointment?
So we really encourage to, if you can, make your own appointments so that people use the technology to make appointments. We will have a process for calling in, but ideally it's done faster through making your own appointment. So what we would like to have happen, and our team plus Placer, Nevada County are working on that, is when you get that text, they will have a place for you to go into, and it'll send you right to the self-scheduling.
Oh, great. Okay.
Yeah. Now, we have to make sure that it works equally between Placer and Nevada County. So if it could be the first time, it'll send you to Tahoe Forest Hospital District webpage and you have to do it there. But I believe everybody will, the goal is that it's actually done on the county websites. Because again, this is a county clinic that we are staffing. But you just hit that and you go right to the appointment where you can make an appointment. And Jake was nice enough in chat to share the My Turn, if you want to have a look at that.
Yeah, it's Salesforce is what's under the covers there.
Thank you.
I don't know how much Gavin's got invested in Salesforce. But the myturn.ca.gov really is more kind of asking questions. What's your age? What's your occupation? To try to find, like right now, it's just basically to try to find out, like, are you eligible? I guess if the answer is yes, then it will probably in the future take you to a place to schedule.
Correct. Yeah. Thank you, Jake, for that explanation.
Sure.
Judy, this is Mary. Thank you so much for all that you've done and all that you've put together. I wrote to you and Harry. My husband went up to Sierra College to get his shot, and he couldn't get down that driveway before he called me to tell me what an amazing operation you've put together there. So that's great. And I think that this problem will be self-correcting as more and more people get their vaccinations. But right now, there's just this sense of panic around it that I'm sensing in the community. It's like, how do I get it? Where do I get it? That kind of thing. And the inconsistencies that you're pointing out in the communication. Mm-hmm. But I think having these text alerts will go a long way towards sort of dampening all of that. So I think that's wonderful. Now, when you get together at Sierra Clinic, can you co-mingle the allocations for Nevada County and Placer County, or is there some allocation by county resident?
The counties have been great. So no, we don't worry. They say, don't worry. Yeah. We want to get people vaccinated. They want to get people vaccinated. They're both giving us allocations. The goal is tomorrow, what I'm hoping is they'd like to be able to say every week, Judy, you guys are going to get 200 doses, you're going to get 800 doses. If we knew what that was, then we can staff for that. And then the community knows this unknown is really hard. 1 week we had it, this week we don't. I can't even tell, I have no idea what next week will bring us. And so I know it's really frustrating, but again, just think about the counties. I mean, the counties had this, they knew where they were marching to, and all of a sudden one day they're marching not to over 75, they're marching to over 65. And that completely made them challenge. Because in their mind, they're going, okay, over 75, then educators. Well, now you have to add another, 30,000 people on that before you do the educators. So it's been challenging for everybody. And I do want to comment, I appreciate everybody saying our great team. I can't take credit for what happened up at Sierra College. I am going to share some names because what's up there is amazing. And Jason Gradidier has really been the lead, the director that's really organized that location, with Megan Shirley really overseeing the clinical portion of it. And then our PMO staff, Jeff Rosenfeld and Kelly Downs, plus a lot of IT people, just everyone. And then over at Incline, Ellen Bjorgman. But just, it's been amazing, the vision. And that's just that vision. So the airport And I think Dr. Cole mentioned just the collaboration between all of the agencies that are making these happen. And in fact, I should mention that at the Sierra College Clinic, our EMS services, the North Star, Tahoe City, Kings Beach, Squaw Valley, and Truckee, they provide in the room where we monitor people for 15 minutes a paramedic every day. And I cannot thank them enough for really, as everybody wants to be part of that team. So it's been amazing that everybody's working together.
Wonderful. Thank you.
Thank you.
Thanks, Judy. And I just wanted to say again, when we have a common focus and we're all working to that focus, we do work together well. And having the focus of the vaccine and getting it to as many people, that all our partners in the community have really come together to do that. And again, I don't know if there's a way that at the end of all of this, that we can really express our appreciation to how much work they put into having our residents vaccinated.
If I could, Director Wong, just mention one more thing, always just left, but really this couldn't have happened. And really without Harry's approval to say, our job here, we want to make sure that we vaccinate our community, and really appreciate him saying, let's go. So thank you,
Harry, too. Okay. All right. After that, we're going to go on to item 16, things that need board action. And we have Jim Hook, who's going to give us again the corporate compliance work plan. So Jim, are you there?
Yes, thank you. Next time I'll try not to follow an inspiring presentation.
Judy dropped the mic on that one.
In any case, we do have an annual work plan that Martina is going to scroll through for us here. It's organized along the same lines as the compliance program itself, the same 7 areas. First, policies and procedures. Usually throughout the year, we identify one or another policy and procedure related to compliance, of which there are several that we want to modify. So we always have that on the list. The second component of a program is high-level oversight. That's provided both by having a compliance committee and the reports that we make to the board of directors. In addition, later this year, we'll ask board members to evaluate the compliance program, and we'll be doing an evaluation by the compliance committee of the program also. And we're going to start that in the first quarter of this year instead of waiting to the end of the year. The next element is education, training, and communication. Of course, there's training in the code of conduct. New hires get that right away. There's an annual attestation for existing employees and physicians, and then there's health stream training relating to compliance and HIPAA. We would like to do a compliance update for the board, so I'll work with Harry on scheduling that, and also an annual session for directors, managers, and supervisors. The medical staff right now goes through all the ones that are employed, at least, are going through the same health stream training as all employees. So we probably won't have to do a separate medical staff update. Then we also send out our articles to the pace setter. I think last year we had 9 articles which cover privacy and security and compliance. And we'll ask the materials management department to distribute the supplier code of conduct to all vendors annually. Probably the most visible part of the program is the auditing and monitoring. This past year, we completed 11 audits, which was pretty good, especially considering how spread out everyone is. This year, we have 10 on the books. Some of them are the same because they represent risk areas that don't change much from year to year. So things like the 2 midnight rule, home health documentation, external auditing for ICD-10 and E&M physician coding and billing, which actually is an audit of the outside coding services efforts. But we'll also be looking at physician payments, looking at the independent contractors this year, be doing an audit of employee access into the Epic system in particular, since employees looking at records is a continuing problem. And then we'll also be looking at medical record documentation for consents for the transitional care management and chronic care management programs. There's specific consents that have to be explained to the patient and documented when they enroll in those programs. And then also the same thing for patients coming to the rural health clinics. And the Truckee Surgery Center and its accreditation requirements is required to do a medical records billing audit annually. And again, since the coding for them is done by their outside service, the outside service has an audit function within its own organization that will get information from on how they're doing with respect to the services for the Truckee Surgery Center. Item 5 is responding and investigating any calls, complaints, or other contacts. And part of that also would be reporting and unauthorized disclosures to the Health and Human Services Department. Now, we didn't have any this year, that any of the potential breaches, none of them were reportable. So we don't have to make that report, but otherwise it would be due by February 28th of each year. As far as enforcement and discipline, there's an exclusion policy for any employees, medical staff, vendors, volunteers, et cetera, who wind up on the OIG exclusion list and who can't work for the hospital depending on the role they're in. So that policy is always enforced. And finally, responding and reporting to state and federal authorities for any HIPAA or other compliance issues and taking corrective action. So I said these items are pretty much the same since they're following the compliance guidance. And probably the biggest thing we try to do is to vary the auditing and monitoring schedule each year. Not only to cover those things that can be routine problems, but also to look at other areas that haven't been looked at previously.
Jim, question from Dale here. That external auditing for ICD-10 coding, is that required by governmental agencies, or is that something we initiate on our own to ensure we're doing it properly?
No, that's something that the district does on its own. There's really no even requirement for a compliance program. They're voluntary. So this is guidance as opposed to regulation that we're following. But one of the important elements of the guidance is to audit and monitor your risk areas, and in the hospital environment and with physician clinics, coding both for physician claims as well as hospital claims is a major risk area.
Yeah, well, under or overbilling, yeah.
Yes, billing for services that weren't rendered, unbundling things. There's a whole host of things that you could be doing wrong, unfortunately.
Okay.
Hey, Jim, have we ever, the board, evaluated the compliance program in the past?
Yes, in past years, there's been a Survey Monkey survey sent around.
Okay.
We didn't do that last year, so we'll want to do it this year.
Okay. Have you any other comments about the plan? So Michael, the first time you've seen the plan, or did we have it last year when you were on the board? It's all a fall.
It would have been in February. So if we would have presented in January, then no. I think I've seen many plans like this, so it looks familiar, but I may not have seen this exact one.
We might have covered it at your orientation session, Michael.
That's true. Yeah. Well, what seems like many years ago, even though it was only like 10 months ago, but what happened in the last 12 months?
That's the last time we saw you, Michael.
Yeah, that's right.
In person, yeah. Okay, are there any questions from our audience about our plan? Hearing none, can I have a motion to approve the corporate compliance program for 2020?
So move.
Oh, to 2021, I'm sorry, I'm still,
Wow.
We don't want to redo 2020.
No.
I just want to eliminate 2020. Okay, I'm sorry, did I hear a motion to approve?
I will. This is Art. I will. I so
Okay.
move.
Okay, so it's been moved and seconded to approve the corporate compliance program 2021 work plan. Martina, will you call the roll?
I'm sorry, who was the second?
It was Michael. Director
Okay.
King motion and Director McGarry second.
Thank you. Director McGarry.
Aye.
Director Shamblin.
Aye.
Director King.
Aye.
Director Brown.
Aye.
Director Wong.
Aye. So the plan has been approved as presented. And thank you so much, Jim. And we look forward to hearing your reports in 2021.
Oh, boy.
Okay, so we'll move on to 16.2, the CEO fiscal year 2020 incentive comp. And Mary Brown, chair of the executive comp committee, will do the presentation.
Yes, I will. Thank you. Yes, the executive compensation committee met last week or actually earlier this week. And as part of its charge, we go over the items that comprise the incentive portion of the CEO's total compensation package. So to refresh your memories, Harry is entitled through the incentive program as much as an additional up to 15% of his salary, which is contingent upon his achieving the goals that have been set out for him at the very beginning of the year. So Martina sent out to everybody this morning a copy of those goals and where we wound up at the end of the year. Martina, I don't know if you have those to put up on the.
I can. Give me just a moment here.
Well, the first item that will be up there will be around finance. Finance is pretty much a drop dead item. If you don't make that number, if you don't achieve that goal, then the are irrelevant. We have to make the financial goal in order to pay out the incentives and the gain sharing as well. So this is true for everybody in the organization.
Mary, it might be.
You'll have to give me a second, Mary. For whatever reason, I'm having an issue with the PDF, so hang on.
Might be good to point out that finance is 60% of the 100% of the potential bonus.
Right. Every one of these categories has a weighted value, and finance is obviously the largest one at 60%. And the reason that we are doing this compensation package now, or reviewing the compensation package now, is because we waited for the audited financials from Moss Adams. And that's true of the gain sharing program as well.
So Mary, just as we're waiting for Martina to put that up, I do have to say that the criteria, I'm just amazed at the achievement of all of that during a COVID year and a pandemic. And so I think that is a real attribute. And I think Harry should be very proud of what he's done this year. And I'm sure he is. And I'm very proud too of what he's done and his whole team to get us where we are, despite all the challenges that happened this year. To have our patient satisfaction scores continue to go up, to have our engagement scores to go up, to have our finances to where they are, and our growth to continue to grow is just so awesome.
It's quite a success story, I think. I mean, it's just,
Yeah.
it is truly
I
remarkable.
apologize. I can't even get back to my Zoom screen. So
Okay,
you're gonna
well,
have to bear with me while I try to figure this out.
so you'll with me here then. So essentially with finance, what Harry was charged to do was to meet or exceed the budgeted net income that had been approved by the board for the fiscal year 2020. And I wish you could see the chart right now. Maybe you can look at your thing from this morning. But that goal, recalling by memory, was around $7 million. As I recall, all things in and making adjustments for the federal contributions and the gain sharing, the previous accrued incentive comp and those kinds of things, we wound up with a net number of 17 million. 17 million is certainly greater than 7 million. So I think that there's no question that Harry achieved that particular item. So are there any questions with regard to finance on this? Because Crystal's hopefully here. She can help me. There we go. Okay, you can see where, thank you, Martina. So you can see where the budgeted net income for 2020 was to be almost 2 million. And that we came in at 17, almost 0.5. So that's a 242% increase over 7 million. So it almost looks like the GameStop stock of late. So in terms okay, and so any questions about financial? So that's a check, we got that one. So can we move to service? Thanks, Martina. Service, as you can see, is 10% of the incentive plan. This goes back to a baseline in 2016 of a total average of all of the departments of 93.76. So the goal here was to meet or exceed the 93.76. And it was exceeded by almost an entire point to 94.75. So that's another check. Does anybody have any questions? Mm-hmm. Okay, service.
Now this is quality.
No, quality is next.
Oh, I'm sorry, we just did service. Quality is next. So this metric is actually a bundling of several clinical factors. The factors change from year to year, but they are factors that are found both on the CMS list of recommended items, as well as our med staff quality things that are being measured. So they're not just some random thing that just kind of gets picked and put up there. So our goal again was to meet or exceed 94.25. This one was blown out of the park at 98.74. So next year we will be changing the goals yet again or the components to the bundle yet again, and hoping we'll exceed that in that year too. Questions? No?
Nope.
Okay, well, here we are at growth. In growth, our goal was to exceed our physician office visits by 3,000 over the preceding fiscal year. This is all for all the owned and managed physician offices. So our goal being 3,000 over fiscal year 19, our goal was 84,141. And if you look at the chart there, you'll see that we were humming right along and we were on target to actually maintain a number of 88,000 physician visits for the year. But then along came March, April, and May. And especially in the month of April, we pretty much fell off the table. So although we rebounded a little bit in the month of June. In total, given all that happened, we only fell 541 visits short of our goal, which is about 0.4% of the overall goal for the year. We talked very extensively about this at the meeting, and given the enormity of the situation that we were living through and the difficulties that the health system managed to weather, the executive comp committee felt that, and we are formally recommending that the board consider this goal achieved. I think that to have come that close is remarkable in and of itself. So this is coming as a recommendation from the committee, and it's something that will then be a part of the motion at the end of this presentation. But are there any questions about that?
Nope.
A question that I had, and maybe it's reflected in those numbers, but did we not close the offices for a while that they weren't seeing any patients inside, and it was all virtual?
Absolutely.
And so
That was largely the case, Chair Wong. We went from around 2,300 office visits, physical office visits a week through about the second week in March. And then we fell all the way down to 400 per week. And then we started inserting in some telemedicine visits. And again, this was as a result of a national declaration of emergency and a state declaration of emergency, and our health system declared an emergency as well. So we were trucking along to hit 88,000 at least. But when you have several weeks of going from 2,300 to 400, and we only fell short by 500, I'm so proud of what our team did. Number one, to take care of patients, but also just to navigate a never before seen pandemic.
Thank you, Gary. And our last item is people. I keep wanting to push this up, Martina.
Yeah.
So in this goal, it was hoped that we could meet or exceed 3.92 on the fiscal year 20 physician engagement survey. Let me just pause for a minute and remind you that the physician engagement survey is only done every other year. On the off years, we do the employee engagement. So this 3.92 was based on that survey 2 years ago. And this year, in spite of all that happened this year, we were able to raise that score to an average of 4.08. So again, another check mark and another remarkable number. So any questions on people? No? Okay. Well, in summary, let me say that we're asking you to accept this information and to affirm that the CEO has achieved 100% of his goals, including the goal for growth in fiscal year 2020. And those were the goals that were laid out for his incentive compensation. And I think it's compensation that has been very well earned. And I congratulate Harry. And so I will make that motion.
And I will second it.
Okay, so it's been moved and seconded to accept the recommendation from the incentive comp committee to give Harry 100% of his incentive comp.
Any public comment?
Okay. Did you hear any, David? I didn't hear any.
I did not.
Okay, so then
I see no
Martina.
hands raised.
No. Martina, will you do the roll?
I'm sorry, Director Brown made the motion and the second was by who?
Gail.
Gail, okay. Director McGeary,
Aye.
Director Shamblin,
Aye.
Director King,
Aye.
Director Brown. Mary, are you on mute?
No, I'm not.
Oh,
I.
And Director Wong.
Absolutely. So the motion carries, and our CEO will get his incentive comp for 2020.
Alice, if I could say a word, I just would like to thank the board for your encouraging deliberation. None of this would be possible without an amazing team and an amazing board. The path that this organization has been on over the last 5 years is very rare. It's very incredible. I've been doing this a really long time, and I just get the pleasure of being a servant leader of the group, but I'm really proud of what the team is doing and how we're able to fill gaps and hopefully honor patients a little bit better every year as well. So thank you for your encouraging action.
You're welcome, Harry.
Job.
So now we go to the financial reports that were pulled from our consent calendar. And Mary, you pulled that.
Yeah, I asked that that be pulled, Alice, because the Finance Committee met, I think, 2 or 3 weeks ago, and we were able to hear a very expanded explanation of the contractual allowances and the bad debt that were incurred in the month of December, which kind of skewed the results for the entire month. And I just thought it might be something that the board would be interested in hearing more about. So that's why I pulled the issue.
And I guess, Crystal, we're going to have you tell us about that.
Unless Mary wants to try.
Everybody.
So I will do the best I can to explain this precisely, I guess, is the best way to say it. So what you're seeing on the December financials, you'll see that there's a fairly large variance on contractual allowance on the income statement, about $4.1 million. And there's a $1.2 million negative variance on bad debt. And these adjustments are directly related to our fiscal year 20 audit. So let's kind of start there. When we close the books on accounts receivable represents all the patient accounts that are still open that haven't been paid yet. And we make an estimate of what we believe we're going to get paid on those accounts. And that brings us to what our net patient accounts receivable is. Then, as we go through the next couple of months with the audit, we look at our actual cash collections compared to the estimate we made. And normally that is very much in line. Our audit is conducted during the last part of August, early part of September, and we look at the cash collections during that time frame, and our estimates are pretty solid. This was a weird year where we kept the audit period open for 6 months post fiscal year end. And so until the audit report is actually issued, you continue to monitor to make sure the numbers that you have recorded at the end of the fiscal year hold true. So we were monitoring our cash collections during the 6 months post fiscal year 2020. And what we found is that we had actually collected more dollars related to either fiscal year 2020 accounts or older than what we actually had recorded on the books. So if you recall, during COVID, when we had a lot of departments that were shut down and extra staff, we bumped up the use of our outside vendors. We've had a huge project going on with Mercy and what we call Big Epic or the corporate Epic. And all those things paid off. So we actually collected $1.2 million on accounts that were from fiscal year 19 or older. Now, typically those accounts are like 100% dead. And we reserve for that at 100%, as if we're never going to collect that dollar. But we actually collected $1.2 million of that. In addition, we were able to collect another $2 million on our 2020 AR. And that has a lot to do with getting our rate set for the rural health clinic, which bumped up those collections. We were able to go back and build Medicare for secondary claims that were stuck in our system. There was a lot of work that was done. So we ended up collecting $2.1 million more than we had estimated. So what ended up happening is that what we had recorded on the balance sheet at 6/30/2020 was too low, because we actually collected more than the amount we had on the balance sheet. So we recommended to the auditors to make an adjustment to the tune of about almost $4 million to bring the net patient accounts receivable up to what it should have been, because we had 6 months of data to look at to know we actually had better cash collections than what we had estimated. So I'm going to pause there. Did that make sense so far? Okay. So now that's all great news, because that actually helped our net income from fiscal year 2020, because it belonged in that fiscal year. But what happened is, as those cash collections came in fiscal year 21, in our last 6 months, we didn't have to record as much contractual allowance in 21 because we were getting the benefit of these cash collections. But since we shifted those cash collections back to 2020, we had to reset our contractual allowances in 21. So we made, in essence, what would be a 6 months worth of an adjustment in December to get us where we needed to be to move forward with the next 6 months on a fiscal year basis. So what you're seeing is basically the impact of the audit adjustment in 1 month. Make sense?
Yep.
All right.
Okay.
So no money gained or lost, just putting it in a different slot.
Right. It basically is moving it to 2020, the year it belongs in, and we're resetting 2021 to where it needs to be.
Well, Crystal, I've heard that twice now, and I still couldn't explain it.
Yeah, I got a better idea the second. I got a better idea the second time, Mary. So.
Better.
Well, as long as it made sense, you don't have to explain it.
Yeah.
Okay.
Thanks so much for that that presentation, Crystal. It does give us a better picture of why the numbers were what they were, and hopefully when we get into the 2021, we'll have that better estimate like we have always had in the past, or prediction. So thank you again for the work you do.
So Alex, if I could just add real quick, if it's okay. Through this process, we did recognize we were probably a little too conservative on our Medicare reserves. So we did actually adjust those going forward. But other than that, our auditors agreed we really don't need to change much of anything except for continue to monitor our cash collections. And if we're more successful like we were in 2020, then we'll just adjust accordingly. So what was really weird about this is just having 6 months worth of data instead of 2 months worth of data.
Yeah. Okay. Are there any other questions for Dale? You had another question?
I thought it should be noted that the year-to-date numbers still look excellent, regardless of this adjustment. We're still well ahead in net operating revenue, well above budget. The numbers all in all are great for the 6 month ended.
Yeah.
Any other comments from our audience? Then can I have a motion to accept the financial report as presented?
I will make that motion. Thank you.
So Director Brown has made the motion. Can I have a second?
I'll second.
Okay, and we have a second by Director King. And then Martina, will you do the roll, please?
Director McGarry,
Right?
Director Shamblin,
Aye.
Director King,
Aye.
Director Brown,
Aye.
Director Wong.
Aye. So the financial report, Crystal, has been approved as presented. So thank you so much. We've had two committees, I guess, that have met. We've sort of heard about what they've been doing, but does anybody want to add anything from the finance committee that met?
Well, the finance committee met primarily to review the audit report prior to the audit presentation that was given to the entire board. So in as much as the entire board has heard the audit report, there's really nothing that the finance committee could add to that.
Okay, thank you, Dale. And then the CEO compensation committee met. Is anything additional to add from that committee?
Yeah, I do have one other lengthy discussion to report on, or one thing that we took into discussion, and that has to do with the CEO total compensation, which would be Harry's salary plus his incentive compensation that we just talked about. And so we were aided in this discussion by a gentleman named Ben Teichman with FutureSense. FutureSense has apparently been used in the past to give us a sort of a scan, if you will, of the healthcare compensation environment and where we fit into that. So in order to do this, FutureSense has access to a tremendous amount of data, both national and statewide data as it relates to compensation, and it gives us the ability to draw comparisons where we want to. So it was Mr. Teichman's opinion after looking at all of this data and the like, and he was opining to us that he felt that given Harry's more than 40 years experience in healthcare and the kind of success that we are having at Tahoe Forest under his leadership, that his total compensation should fall somewhere between the 50th and 75th percentile of his peer group. And I think we all agreed, we all sort of around the table there, we all agreed that that was a good range. And it turns out that where Harry fits is actually the 63rd percentile. And that is exactly what we had sort of thought was the right place to be. So I just put this out there to rest assure everybody that we are neither overpaying nor underpaying in the arena of executive compensation. And I think we have a pretty remarkable individual, and I think that is worthy of every bit of it. So thank you.
Thanks, Mary, for your report. Any comments or anything for Mary? Okay. Are there any other board member reports?
Yeah, the foundation did meet this month, and not much to report out on. It was sort of a let's kick off the new year meeting with I wouldn't say any deliverables or outputs on new ideas, but it was more or less a call for new ideas, especially as we anticipate that ongoing in-person events are probably going to be limited for the foreseeable future. So things like the Best of Tahoe Chefs is unlikely to happen. So a few ideas tossed around how we might make that either a virtual event or break it down into smaller venues, those kinds of things. But really more or less just a sort of kick off the year in planning, but not a lot of reportable action from the meeting.
Thanks. Thank you, Michael. Any other comments? Well, if there isn't any, we will go.
Alex, I'm sorry. I think Judy had something she wanted to add about Incline and their foundation.
Oh, I'm sorry, Judy.
I apologize. I did miss one item. You know, we know that all of us that had vaccinations are thankful, and a lot of us that went to the Eskridge probably never seen such a joyous place to get a shot, you know, and up at Sierra College. But what I didn't mention was we had a community member last week who was so thankful for getting their vaccine and the absolute fantastic service they got from the nurses there and the staff. They've given $100,000 donation to Incline Village Community Hospital. So I meant to mention that, and I didn't. And I really wanted to, again, recognize really all the staff who work at that and what they really do and the difference they make. And really thankful again to that donor for that appreciation of that donation.
That is wonderful to hear, Judy. And again, the staff that provided the vaccines and the environment in which they did it. If I had $100,000, I probably would have done it too, but unfortunately I don't have it.
You would, Alice.
But I will be getting to the grateful patient. So that was great to hear.
That's the
Any
kind of
other
person you want to wait on when you're waiting tables.
Okay, any other closing remarks? If not, then we will adjourn the meeting of the Tahoe Forest Hospital Board of Directors. Thank you all for coming and have a safe evening.
Thanks, Alice.
Yeah.